Thank you for joining us for tonight's webinar. It is a pleasure to introduce our guest speaker, Dr. Nathan Vermaak. Dr. Vermaak is recognized as one of South Africa's most prominent aligner providers and is highly respected in his expertise in modern digital and aesthetic dentistry. His commitment to clinical excellence and innovation has positioned him as a leader in clear aligner therapy and smile transformation solutions. At Smile Club South Africa, we are proud to have Dr. Vermaak as our key opinion leader for veneers, as well as one of our hands-on lecturers for active aligners and injection molding. Through his teaching and mentorship, he has helped many clinicians develop confidence in incorporating these advanced techniques into everyday practice. What makes Dr. Vermaak truly exceptional is his passion for education and his ability to combine practical clinical experience with simple, predictable workflows that dentists can immediately apply. We are privileged to have him with us this evening. I know you will gain valuable insights from this presentation. Please join me in warmly welcoming Dr. Nathan Vermaak. Over to you, Nate.
Thank you, Dr. Vlad. Hi, everyone. My name is Nate, and thank you for giving up your precious evening just to learn a little bit more about Smile Club's latest offering, which is premium veneers. So let's hope I can stick to these time limits I've set out for myself. This is basically what we want to cover tonight. From what I see, and I'm sure a lot of people that do a lot of veneer cases have been seeing in the past, all the way to how we start with particular Smile Club premium veneers. Okay. So as Vlad mentioned that I'm Nathan Vermaak. Tonight I am speaking to you in my capacity as a key opinion leader for Smile Club veneers. I do have a small dental clinic that is based in Mars Arch, but we have a fairly high focus on optimally invasive dentistry is the word I'm going to use for it, but it's also using the most advanced tech that we can get our hands on. All right. Okay, so start off by what maybe was the backbone for wanting to have a webinar and the need for a product like these premium veneers. Because what I had been seeing, and colleagues of mine that I chatted to about it as well, I've been seeing is that with monolithic mold veneers, one of the things we often see is that any effects on them look very much painted on like it would be on a canvas on the wall. Okay, which up close gives the perception that the teeth are artificial, which they're not natural, but they don't have any of the natural characteristics, even though lithium silicate is a great material to use for light reflection and having the natural look. When you're looking at thicknesses of in an incisal edge of about 1 to 2 mil of a uniform monolithic cut veneer, it doesn't really have the same effect as natural enamel. So more and more patients are starting to notice that when people have artificial teeth or veneers from a mile away, which is the look which some people are going for, but more people are wanting their veneers to look way more natural. Another thing that you do notice, particularly with mold veneers, is that margins chip, and that's due to chatter from birds when they're busy being cut, because veneers don't have very large, thick, bulky margins. It is very possible for that to happen almost every single time if the margin is thin enough. Once the gloss is lost and the natural wear and tear happens, your surface characteristics which were painted on also fade with time. So it's one thing you also can notice with monolithic veneers that have been stained and glazed to add character, is that over time they will all look quite opaque and monotone. So what labs have been able to play with is the selection of material that they use, how they texture the surfaces, and how to manipulate margin quality as well as communication around. Now, when we're talking mold veneers, what often happens is, yes, they stop using off-brand lithium disilicate. They use the original, which is EMAX, that helps with the chipping and the actual longevity. But with the internal characterization, you can do like a micro cutback and build up, but you still can't get the same depth. One thing I've always lacked to find is surface texture. Most veneers are very monoplaned, where a natural light reflection won't be perceived the same way as it does in natural tooth. And margin quality, the biggest thing that gets changed is if you've got a chip margin, EMAX then gets packed on that margin to kind of rebuild it and restructure it, therefore making it not necessarily monolithic anymore. So there's 4 distinct things that separates a natural from a milled ceramic: translucency, internal depth, surface character, and the edge integrity. Okay, so from how light passes through in the tip, from how it looks in the incisal edge to the body, from a light and also from characteristics from the inside. Surface texture too, with a tooth or enamel, even though it feels smooth, there is still texture and characterization from pericymata all the way to some form of chipping way or anything like that, which add character, which you not necessarily want to recreate something like chipping, but it will also still change how light is perceived within an enamel beyond or above the chip. Okay. So why did Smile Club Veneers speak out to me? So I was having all the issues of more patients coming by saying veneers look fake in general. Other countries, they have the possibility to make them look more like natural teeth. There's more natural appearance. There's differences in translucency from the tip to the toe. And all those kinds of things have always left a little bit of a gap in my portfolio offering of aesthetic dentistry. That's why something like premium veneers from Smile Club does make sense, because lithium disilicate is what most people are using for their veneers, which is EMAX. But something happened along the way where pressed EMAX kind of got it pushed to the side because, 1, it takes longer, and 2, it's not as simple as just having a design, mill, finish. There's more steps involved and there's more craftsmanship involved, which takes time, which will then also drive up the cost of the product. Okay. The second thing is I have not many cases where I've asked for some form of translucency. Does it translate to a way where it looks like a natural tooth and how it actually does? Most times it's micro cutting back, leaving only a small cutback in the buccal portion and then building up in that area. And then once it's glazed, all surface texture kind of looks fairly flat. And then any of the translucencies that we do see is pretty much just in the last half a mil to a mil of the incisal edge there. Okay. So this is the main difference. So we have to look at milled and stained-glaze, and even just conventional pressed and non-laid, right? They're all the same product. They all carry similar properties in the strength. They all carry similar properties in how thick you can or thin you can make the restorations. So we have to look at the appearance, because we're not talking the difference between zirconia and EMAX in this scenario. We're looking more at the difference in how we get to the end product. Okay, so when we're looking at properties like translucency, most of the time when we put on our lab slip high translucency, low translucency, even if we do that when we're asking for something like a veneer, it is generally not any different in the translucency from where your gingival margin is all the way to your incisal edge. So what happens in a layered technique is, of course, that cutback allows for the ceramic to be built in the different body parts of the actual tooth. When we look at the internal depth, there's one thing and say, okay, we have a little bit of translucency, but what are you seeing there? If you just have a translucent tip, it means not that much. When we have the internal depth there, where you can have halos, mamelons, if you want, you can put a fleck of blue, you can do a little bit of yellow if you want to mimic something that doesn't look completely perfect. There are those options. Whereas in our traditional milled or stained, or even just any, even cast or pressed, where there is no layering to it, we then only have it painted on the surface, which yet again brings on our non-3D dimensional look, doesn't reflect light differently. It's just a visual appearance from one angle, and it's usually very face on from the patient and from far that you see the detail. Up close, not really that great half the time. Okay. So pressing a veneer or pressing any restoration allows us to have much stronger margin. Okay, why is that? So the traditional way of pressing a restoration doesn't have to necessarily be a veneer, is you have some form of wax on a model, and then it will work in a similar way to how we cast other materials, where the wax gets put in the furnace, it melts out, and in a negative space, we push in the EMAX material. So you don't have to worry about a drill bit cutting that margin. It's where the wax ended. Okay. So that's one ceiling that we find with milled restorations. If you want a 0.3 mil margin, the chance of being 0.3 mil everywhere in your prep is very slim. So if you have somewhere where it's 0.15, 0.2 mils, it's going to chip, or it's not going to be completely smooth. And another thing that we can also talk about when we're talking about the manufacturing differences is with the burr geometry, when you mill a crown, sometimes what we see is like a dark line come in our restoration. And why that is often is because when it's cutting, there was an undercut or the burr could not get in there, because most mills have a 1.2 millimeter burr. So that burr can't get into a 0.8 mil space, so it has to over prepare the restoration, often leaving discrepancies in the thickness. So that, especially in veneer cases, can leave you with dark lines in the veneer, which aren't very aesthetic long term or even immediately. Okay, so the best case use is if you want to go for fairly cost effective, high volume cases where you're not too worried about the detail or the patient's not too interested in high-end aesthetic, they want that Hollywood look, you're probably looking at a milled restoration. But when you want to elevate your work, when you want to kind of look twice yourself and say, is that a veneer, is that a natural tooth? You want to be looking more at a layered technique where the veneer is first pressed, and you can get whatever characteristics and different variants of translucency, integrity, internal depths. You can see all these different things to whatever degree you and your patient decided. Okay, so enough of me just talking words. Let's see what the actual veneers look like. And these are real patients, real veneers. It's not made by AI. It's not Grok 4000. This is real world scenario that we're seeing here. Okay, so top left, this was the first veneer I had received and took a photo of. Okay, so as happy as I was, I whipped out my flashes, and this was probably the first time I was taking a photo of translucency to not show a problem where there was translucency, if that makes sense. So I wasn't trying to find a flaw, I was looking at the beauty. And in this case, particularly, because there wasn't much crown heights to work with in making the incisal edge as beautiful as possible, we went for very low translucency, low detail of the mamelons, but you can still see the difference. Okay, this is a different case, but you can see it's a little bit more accentuated. We wanted more bold canines, wanted a little bit more translucency, a lot more anatomy. And if you can see, particularly here at the angle, the surface texture is just phenomenal in how the light dances off of it. You're not just seeing a flash and it's flashing back. Look at the line angles, how the light is just dancing and playing with the actual veneer. Aesthetically, what we have to remember is it all looks great and well when we look at it on the model and we're like, this is good. The patient will like. We have to remember that our patient lives. They go to birthday parties, they go to work functions, and that's where the true characteristic comes out. The smile is elevated by the fact that they're more confident, that their teeth look otherworldly. Because if we look at this video again, look at how it moves. That's real life, how you'd see light play on teeth. You don't see that in most veneers. Look at the mesials, particularly on the centrals. There's fairly good focus there. Look how the light just dances there. You can see the characteristic show fade depending on how the angle of light hits it, which I think is the next level in having high-end aesthetics. Yeah. Let's look at a couple cases. So some people might know this. This is one of the co-founders of active aligners. Out now, he was a patient for this. Yes, he did also give permission to use the photos because he's also in the meeting right now. And what we did for him was we took his case and we did his upper 10 so we can get a nice, well-rounded smile while showcasing with different lighting what you can see. Okay, you'll see on the left here, that's just with my large external flashes, which would be what you'd normally see case presentations look like when people post their work on Instagram. What we can see here is, look at how the variable texture is picked up here, because you can see different characteristics reacting differently to light. Okay. You can see also here we went for fairly medium translucency, not overdoing it on the internal anatomy, not as bold as the example as we showed before in terms of design, but it fits his face well, right? On the right here, it's a polarized lens. So what polarized lenses do, basically, for those who aren't aware or aren't familiar with them, is they remove a lot of the glare, so you can see less of the interference of light. Okay, so you can see a little bit more detail on the side. The teeth look darker because we're not getting that loud light bounce back that we were getting in a normal studio flash system. Okay, so the glare is somewhat removed so that you can actually get more of the detail. So this case was 10 units. There is actually a mixture of veneers and crowns in this case, which is very possible using the veneers. You can even mix, for example, if you wanted this canine to be in zirconium, it gets color matched, it gets built up in a very similar way. Yes, you can do a cutback on zirconium. It's very possible. It's very common in many countries to do that. You don't necessarily have to have this highly anesthetic or opaque material. Okay. This is another before and after. So this kind of a case would be a good case to show we need to have good occlusion for veneers. It's not one of those treatments where you can cut your way out of trouble. You know, you can't cut half the tooth away with a veneer and expect either A, a good bond, or B, a good aesthetic outcome. So for this lady, the first thing was to get the teeth in a more comfortable position occlusally so that we don't have any issues with adding porcelain on top of it later on. Okay. One thing we also always have to account for is we're in an age of where we're trying to do things as minimally as possible. So if the teeth are in the correct position, you can then do much less preparation to get any restoration in there, not just these particular veneers, but we need to be thinking more longevity-wise. Okay. Also, the more conservative you are with the veneer, in terms of prepping, the better your bond strength. As we know, we bond way better to enamel than we do to dentine. Okay. And in this case, the results speak for themselves. Like, you can see how everything looks pretty much picture perfect in her mouth, whereas before it looked fairly anesthetic and functionally it was not very functional. As you can see, why would the teeth chip? Why would there be wear facets? Why would there be areas where we know we can obviously see that there's wear and tear, particularly like in sizable edges and canine edges. Okay. Another case is we're replacing old mold veneers with new pressed veneers. Okay. A few things to take note of here. Yes, you might ask the question, why replace them? Patient was wanting more of an aesthetic result in this case. One other thing you can notice is because no extra length was needed, wanting to be taken off the incisal edge, the teeth are slightly longer, which if you look at her profile is very fitting for her. But in general, you know, we try and be super ultra conservative, but we forget that we do have tools that allow us to actually increase tooth length, which is like digital smile design. So we can predictably see where the outcome will be and see functionally, will it work? Aesthetically, will it work? And most importantly, will it be as least invasive as possible so that we can still practice do no harm? Because as with any ceramic restoration, lifespan matters. So the less tooth we prepare, the less we subdue our patients to later down the line with invasive treatments. Okay. So minimal prepping has been a little bit of a buzzword for minimalistic work, doing less invasive. We have to always remember the moment we cut a tooth, it's invasive. So our job is to make it as least invasive as possible, right? So with that, we need to be using the minimum parameters we need to be able to get a predictable restoration. And where often that comes in is unless you've got a unique patient or they've had previous orthodontics, we first need to make sure that the occlusal relationship is 100%, right? Not only from a function in the bite, but also from an anterior posterior position of where we want to end up at the end of treatment. That allows us to design a smile where we can use the design almost as a prep guide, it's known as the APT method, where you use the design over the teeth and you use depth cutting burrs and you prepare only where it is necessary in the quantity that is necessary. There's no guessing, taking a burr and going, I think the lab technician might need a little bit more space there. It's predictable in the sense that you get the same outcome 9 times out of 10. The only time you don't get the correct outcome is when you don't follow all the steps that you would need. So in a case like this, you would align, bleach, and bond, but in this case, bond wouldn't necessarily talk to injection molding unless it's a medium-term temporization to check occlusion, but you'd bond in the ceramic restoration. Okay, but the key driver factor from this minimalistic view is that we want to do all the planning so that we're prepared to only remove tooth wherever necessary. Okay. So back to the comparing a little bit between milling and pressing, particularly when we're talking cutback. So now with pressing, you can print your wax with a 3D printer, so you don't have to physically wax it up. But going back to the origins of pressing, everything was waxed up by hand. We do have to kind of take a step back with veneers and look at them as an art form, because it's very often that we see these days, it's becoming more like a churning out patients kind of a thing. So it's prep one day, you get a cheap restoration, you get stuck in, you're done, cool, you make money. So we need to kind of bring the art back into that form of dentistry, as in hands can do what burrs can't necessarily do unless they're in a hand. So when we're milling, we can't get the finesse, we can't get the uniqueness. Yes, sometimes when we're layering and we can have slight discrepancies, which is beautiful in its own way. Whereas if we mill, we can copy, but it's not always bringing across the beauty. Yes, we have symmetry, but that's not always what beauty has. So when you look at this inner mouth, it kind of looks like it always belonged, not like it was something put there by a dentist. So I think that's one thing we have to reimagine. What is beautiful about enamel? What is beautiful about the aesthetics of teeth? And it's all good and well saying, yes, I did a DSD, but that's only to bring in the shape and form. It's not there to bring in the natural beauty which we see in teeth. Okay. So more and more people that you talk to notice differences in ceramics, particularly. Okay. With doing a preparation that is optimal, having material thickness that is optimal, it fits seamlessly. Patients after a while don't you're like, oh, how are the teeth? I'm like, oh, I'm not having any sensitivity. Like, how the veneers. They're like, oh, they fit like they've always been here. It is comforting as a practitioner to know that when I'm placing these, it's not just for giving them aesthetic value, but it's also confidence building. It's blended seamlessly with their lives. So when they're coming for a review, they even forget that that's what they're there for. It becomes part of their new, I wouldn't say new personality, but their new confidence, their new feeling of being able to smile predictably and confidently without anyone like, oh, they look fake from a mile away, or having what they had before. Okay. So this is just some more case. You can see the clear difference. This would have been life-changing life-changing to be able to go from having this kind of appearance to this. It is, can't name anyone that wouldn't be happy with this kind of result. Looks natural, fits. The smile curve is good. The anatomy is good. The characteristics from left to right are beautiful compared to having what you had before. Yeah. Okay. We have to also talk about cases like these. So it is very seldom a patient will walk through the door and need one tooth with ultra realistic characteristics, translucency, and texture if they don't have other teeth in their mouth that look like that. So that for that reason, that's pretty much why Smile Club have started only from 6 units. What that basically is if you do the upper 6 teeth, it's very easy to, if a patient has a decent shade, it's to blend it in fairly seamlessly into a smile if there's a decent enough occlusion as well as alignment of the teeth. So it does blend in the treatment a lot better than if you had to try and do 1 to even 4 veneers, because if you do, for example, the interior of the incisors, you're going to see a clear, distinct difference by the time it gets to the canine. So that's the main reason why there is a minimum order on these. When we look at the life-changing option is what I call it, because even when you do a smile design, you show patients designs, and the imagination goes towards how you're presenting a veneer with lifelike texture. Is once they see what's happening behind the canines in the buccal corridor, they feel like their smile wouldn't be complete without 10 units. So I often only do 10 units because it just rounds the smile off. I can plan better. I can build the smile curve better. You can get the aesthetic result that you want. Okay. DSD often only really focuses on 6 units if there was trauma, if there was any form of superior wear in that area for whatever reason prior to aligning the teeth. It's very seldom that you see aesthetically where you want to change only 6 teeth. So that's why 10 units often make a lot of sense. Okay. So if we're talking in terms of, yes, it's cool, how do we get the case started? So there is a platform that is different to if you use active aligners, is different to your login portal for doing an aligner case. But it's fairly simple. You upload all your documents, so STL scan. If you do have DSD already or you have good temporaries, always keep the biocopy of that. What a biocopy is, anyone is unaware of it, is basically a replica of either a design, of a temporaries, of a preoperative, or a DSD. So that the technician has some reference as to where start or end point is. Okay. Photographs are very important because you need to see the face to be able to do the design properly. That goes for DSD principles. It goes for good aesthetic outcomes. It's like you can't necessarily just send a model to a lab technician and be like, please make me 6 veneers. They have no idea of the patient's gender half the time. If you just say that, they have no idea about their facial profile, what would work in terms of filling the buccal corridor, what would work in terms of looking aesthetic in the curve, as well as length of teeth. So it is important to take good quality photos. Okay, so you want to complete the form, and what it does is it asks from what tooth number to what kind of incisal design, how much translucency, how much texture, how much characterization from inside do you want to see in there. It's very granular in what you can choose. If you don't want hectic, you just want inside the tip, you can choose that. It's a minimal option there. All right. So not all cases have to be on the upper end of showing these characteristics, but you can do it so that it'll still be elevated in a way that will make the case appear unique to your patient. Okay. You want to then also review any design work or confirm anything from a manufacturing point of view, and that's when it gets dispatched. So once quality checks happened, the veneers will get glazed. Once you're happy, they get packed and they're shipped, and it actually gets shipped to multiple countries, over 10 currently, and production window is 2 to 3 work weeks. So it's slightly longer, but that comes with craftsmanship and hand work. It's not just a push of a button and the mold cuts them for you. These are made by a technician in terms of the layering part of it, hand by hand, case by case. So it's not, for lack of a better word, the mill factory. You know, it is a bespoke outcome for each patient. So it does take time. Okay. So there is a pricing structure that is in play, and it is more of a launch price structure, as it is still a new product offering to South Africa. So on these prices, as you can see, I think they're very fair. It's for the quality, that the input that goes into getting that result. I haven't found another lab that is more affordable that gives me the same quality. Right. These pricing structures can be shared with you from Smile Club directly. They'll be in contact with anyone who does want them. But what is also important is what's behind them. Okay, so there's a 3-year limited factory warranty. Basically, as I mentioned earlier, you can also get zirconia restoration. So it's not only necessarily for veneers, but if you wanted to do a combination of veneers and zirconia, it is more than welcome. They're more than capable, and it is seamless in the mouth. So Cementation goodwill speaks to, we've all had a mishap in the chair where we put the 1-3 on the 2-3, for example, and stuff like that happens, or it's not seated 100%. Now there's a discrepancy in your smile. The 50% goodwill is they'll replace the restorations at 50% of your case fee. So you don't have to pay for the whole thing. If it is your error as a clinician, I think that is more than fair, because yeah, I've been in situations where I had to pay for a brand new restoration, plus the embarrassment of admitting to both the lab and your patient that you stuck the tooth wrong. But it happens. The Smile Club veneers are serving in over 10 countries, including the UK, US, high presence in the Middle East, and of course here in South Africa. Okay, so every step of the way, there is someone to guide you. If you're struggling with a case uploading, if you want to know the best method for trying cementation, there is advice always available. And that's always been something that separates Smile Club from other labs in general. Is even with aligner cases, there's basically someone there holding your hand should you need it. And it's no different for this. And it's not necessarily anything other than, you know, yes, you're the clinician, but sometimes we have questions that we need to ask, and we shouldn't be afraid to ask it. So the fact that the platform is there so that you can get the support, take it. You know, it will make the difference in having a good case and having a great case. Okay. So once I started seeing the difference in the outcomes, I must say it's hard not to want to send every tooth to get layered. And it feels better, I know how bad that sounds, to place a tooth that you're extremely proud of because it looks really good. Even though you didn't make it, it was a lab technician, you still feel proud that you were part of the process, because when you see the result and you see the reaction of the patient, it's like delivering your first denture back in third year. You know, you feel like you're really contributing into the profession and to the community, even if with a cosmetic kind of treatment. Okay. So there's lots of clinical cases on the website to go over, and Smile Club Veneers also has their own website, as well as socials, so that you can see other results. it's good to know that when often we see new products come up that we think it's fly by night or someone's trying to do something on the side, it's actually just a new product in the line. So Active or Smart Club has been around, Smart Club Lab has been around since 2018. First starting off with active aligners, but if I show you here, this is just some of the offering that you can get from the platform, from the company, from the lab. Okay, so you can do your smile designs. Your DSTs can be done through Smile Club Lab, from injection molding to printing models to making bleaching trays, sports guards, printed crowns. It's there. You know, there often we see businesses in silos, and Smile Club for many has been seen just as an aligner company. Whereas if we look at the product offering that we've been having, I've been using some of these services since about 2019, 2020. So it's not like it's a new lab. It's not like there's workflows, there's integrations, there's support. So you will get help every step of the way, no matter what treatment you choose to use them for. So I think that's important to know, that it's not just like some bitty yarn that you're seeing in the backyard that you're going to get a veneer from. You know, it's quality, there's proper materials, proper sourcing, proper lab technicians doing high quality work. And the lab is also got a resident dentist. So, you know, there is someone that speaks the same language. Sometimes things get lost in communication. We speak dentistry to dentists. So there's always that component that you can have rest assured that there is that line of communication. Okay. So 3 ways you can begin. Right. I think I've stuck fairly well to time. Start your first case. You know, earmark that patient that you think would be a good candidate of your patients, and make sure that you just get going. You know, often we procrastinate in the scenario where we learn something, we're like, oh, that's cool, and then we forget about it. So it's implementable from tomorrow morning. You know, there's no real difference in your clinical skill needed. There's no real difference. You don't need to upskill. You don't have to go and buy equipment to do this. It's just a change in how you approach your workflow and a change in how you approach cosmetic dentistry. Okay. We are also hosting a live workshop where we're going to be trying to summarize cosmetic veneers in a day. So it's a lot to cover in a day, but we're calling it from pixels to prep because we want to make sure that you are able to be more predictable in veneers. And this goes to speak for any veneer, not necessarily pressed veneers. Any cosmetic work, particularly in the anterior region, is we're living in an era where we can predict things based on preoperative investigation, right? So the idea of the workshop is to run through from taking photos and your initial consultation to delivery of your ceramics, what you need to have the most predictable, comprehensive, and bulletproof outcomes. So the idea of that is to bring it into 1-day course where I'll be drawing from international teachings and travels to diplomas that I've attended to just real life clinical scenarios where I've been privileged enough to job shadow some of the industry leaders in DSD, in veneer work over the years, to be able to bring those things in my practice. And I think the idea is to share that in the workshop. It would be held in Johannesburg. It is on a Saturday. And if you would like to register, I think it would be a nice day where you can actually start using that information, not necessarily only for veneers, but to make your practice more profitable, more predictable,